Have you ever lain awake at 2 a.m., 4 a.m., staring at the ceiling, trying to switch your brain off, but you just can't? What if the drugs didn't work? What if it's coming back? What happens if it's metastasized? Waiting for results is a special kind of torture, whether that be scans, biopsies, or blood work. It's not the same as normal stress, not even close, because it's tied to your very survival. It is literally waiting to find out how much more time you have on this earth. Hi, I'm Jeannie. Welcome to my channel, Living with Cancer. Today we're going to talk about scanxiety. That is the name oncologists give to the distress that occurs before, during, and after imaging that comes with cancer. Some patients worry about the scans themselves. They may have claustrophobia or they're worried about exposure to radiation. My aunt actually died of breast cancer because she was terrified of needles. And because some imaging requires contrast, she refused to do the scans and ultimately refused treatment. MRIs are not fun for most people. I've found that putting a washcloth across my eyes helps a lot. I can't see how small the space is, and so I'm a lot less anxious. A little bit of Xanax doesn't hurt either. Exposure to radiation is a valid fear. The risk of secondary cancer is high across all cancers. For tumorous cancers, secondary cancer is recurrence or metastasis. You may get through treatment and be told that you're in remission, and that's a positive outcome. The signs and symptoms of the disease are gone, but that doesn't mean they're gone for good. They can come back. Recurrence rates differ according to what kind of cancer you have, what treatment you've had, what stage you are at. Stage 1 colorectal cancer has a recurrence rate of less than 10%. Ovarian cancer, stage 4, as much as 90%. Non-tumorous cancers like multiple myeloma, which is what I have, they can't metastasize because it's already all over your body and your blood. But exposure to radiation can cause a completely different type of secondary cancer to occur, like leukemia. The possibility of either of those two types of secondary cancer leave us with a feeling of, when is the other shoe going to drop? That's an oversimplified way of looking at it, but the point I'm trying to make is that it's not in your head. The fear of recurrence is real and it's based in reality. So every time you have a PET scan, you wonder, is it back? Has it gone to my liver? Has it gone to my bones? And if it has metastasized, how long do I have? And so we wait. I came across this in Time magazine and I'll read it to you. Scans are like revolving doors, emotional roulette wheels that spin us around for a few days and spit us out the other side. Land on red, we're in for another trip to Cancerland. Land on black, we have a few more months or years of freedom. That's spot on if you ask me. Often, scanxiety can actually feel harder than the treatment itself. When you're in treatment, you're doing something. You're taking action. But in the weeks leading up to a scan, your mind can actually be your worst enemy. You imagine every scenario, from best case to absolute worst case, you're gonna die. And in that in-between time, between the test and the results, you can feel like your whole life is on pause, like you are holding your breath for days at a time. I've had to face this kind of waiting several times, and it is brutal. The first time, we had to wait for results for the definitive test that would confirm that I had multiple myeloma, and that took 2 weeks to come back. I was still in shock and trying to process this new reality of having cancer. But I never doubted that the early diagnosis was incorrect. The hospital oncologist had said to me, the chances of it not being myeloma were tiny. Not impossible, but tiny. But when the test finally came back confirming it was myeloma, I told my husband, and I saw him physically crumple. I didn't realize it at the time, but he had been holding out hope for that tiny chance. He had been holding out for that tiny chance that it wasn't myeloma, that I was the exception. But also serves as a reminder of how difficult it is to be a caregiver. Then came a long series of scans, x-rays, bone density, MRIs, CT scans, more CT scans, and a PET scan. Honestly, by that time, I was punch drunk. There was so much going on, I didn't even have time to be anxious about test results. I just did what was on that day's schedule. After the stem cell transplant, which takes 9 weeks, every set of labs that came back was like a verdict. Was the myeloma still lurking? Had the treatment been successful? Was I in remission? It's a long story as to why, but when I finished the transplant, they couldn't tell me if I was in full remission or not. So I had to have an extra 2 months of chemo, consolidation chemo they called it, just to be sure. I also got a breast cancer diagnosis about 6 months after my myeloma diagnosis. And that was a shock, for sure. Like I said, my aunt died of it, and my sister had a mastectomy in 2023. But once I had more information, I realized that for me, it wasn't a big deal. We had caught it very early. It wasn't a particularly aggressive kind. And as my breast surgeon said, that's not the one that's going to kill you. Blunt, but true. Myeloma is currently incurable. I was very, very fortunate. I didn't have to have chemo afterwards. I didn't have to have radiation either. I will have a mammogram in December, like I always do. And if there's anything fishy, then they will look at it further. But I'm not worried about it at all. More recently, after a prolonged, very severe headache, I had a brain MRI, and it showed that I have a brain tumor. Waiting for the follow-up visit that would tell me whether or not it was malignant, that was about the longest week I think I've ever lived. As it stands right now, they are confident that it is not malignant. I will have to have a brain MRI in about 4 months' time just to be 100% sure. But it's not something they're worried about, and it's not something that I'm worried about. So with breast cancer and brain tumor out the way, I am left to focus on myeloma. Today they monitor the myeloma on a monthly basis. I have labs drawn. They test the health of my kidneys, of my immune system, and a few other markers of myeloma. For instance, they monitor what is called an M spike. Essentially, it tells you whether the myeloma is active or not. No M spike, not active. With an M spike, active. Except it isn't that simple with me. Shocker. To make things even more complicated, the chemo that I'm on, I go in once a month and I have a jab. That chemo can actually cause false positives. It messes with the test. So if you have an M spike, it could be the myeloma, but it could also be the chemo. As a result, every ping on my phone telling me that I have a message from my doctor or a new test result, every time my heart drops, skips a beat. Some months there is an M spike, some months there isn't. And that kind of uncertainty is brutal. The advice the experts give us, it's kind of lame, if you ask me. Distract yourself, they say. Sure, put on a TV show, hope that nobody dies of cancer, and that takes care of a whole hour. They say stick to your routine. They say live in the moment. Yeah, but that's easier said than done. If those things actually do work for you, let me know in the comments, and if you have any suggestions for making the wait easier, please tell us. I'm all ears. One thing, resist the urge to Google survival rates at 2 a.m. in the morning. That never leads to a good place mentally. In fact, try to stay off Dr. Google completely. When I was first diagnosed, my oncologist said to me, don't Google myeloma. First, there is so much misinformation out there. And second, the information that is there is usually out of date. A clinical trial from start until the time it hits the internet takes 12 years. That information is completely outdated. I'm very glad that I followed her advice. Initially, I didn't go online at all. And then once I was a little bit more in control of my life, I looked up certain things. But I still don't know how people with multiple myeloma die. I don't want to live it twice. Every time you feel tired or you get achy bones, you think, oh, this is the beginning of the end. So I will find out when I need to find out. And until then, I'm just going to put my head in the sand. Like she said, there is loads of misinformation out there, particularly on social media platforms. Social media algorithms prioritize engagement over accuracy. That means misinformation or sensationalized content can easily go viral, even though it's harmful. Prime example was COVID. So I encourage you to not go online for information. Stick with your oncologist. She knows best. And whatever you do, don't put information through an AI. I did that. I took a report that I didn't understand and I put it through ChatGPT. You're going to get answers that you don't want, and the information is going to lack context. Stick with your onc. The bottom line is that scanxiety is real. It's exhausting, and it can make you feel like your life is on hold. So if you are waiting for results right now from a scan, from blood tests, from a biopsy, you're not alone. Every person with cancer knows what it feels like. The waiting sucks, and cancer sucks. There is no quick fix for this. All we can do is support one another. That is all I have for you today. If anything in this video resonated with you, please like, subscribe, or leave a comment. And one last thing, I am not a doctor. This is not medical advice. I will see you in the next one.